So in addition to serotonin, norepinephrine, dopamine, glutamate, and GABA, we now know there are all kinds of other neurons in the brain that work on the nervous system and that work for symptoms. Histamine, for example. Histamine is a turn-on neuron. It's an awake-producing thing. Stop and think, what do we take for colds? Antihistamines, which work to block histamine. And when you block histamine, how does it make you feel? Kind of goofy and slowed down and whatever. Histamine hypes you up. Acetylcholine. Acetylcholine is a drug or a neurotransmitter that we now know is important in cognition, memory, and attention. The drugs that we now have to treat Alzheimer's disease, the main one, Aricept, is an anticholinesterase inhibitor. So it works to increase acetylcholine. So we often use drugs of one class for another, and that can be confusing. Take, for example, the Abilify patient. So their doctor says, look, your antidepressant is working some better, but we can make it work mo better if we add Abilify to it. So the patient don't know from Adam, and they say, okay. So they get their script from Abilify, and they go to the web, and they look up Abilify, and it says, this is for crazy people who have delusions and hallucinations and are psychotic, because it is an antipsychotic. And the patient thinks, they gave me the wrong damn medicine. Or their next door neighbor tells them, what are you taking that stuff for? My friend who's got schizophrenia takes that stuff. Or my friend who's got bipolar disorder takes that stuff. Do you have either of those? No. You probably shouldn't be taking that stuff. And that's when they come to you and they say, should I be taking this stuff? And if you don't understand, you're likely to be confused as well.